In this episode of the ASC Podcast with John Goehle, we discuss the latest news in the ASC industry, recent survey experiences, we debrief from ASCA 2026, review the new Anthem policy on out-of-network providers, we'll discuss cardiac ablations in the ASC environment, and in our focus segment, we'll share an interview with Becky Ziegler-Otis, who is the Assistant Executive Director at the ASC Quality Collaboration.
Welcome to the ASC Podcast with John Goehle, the longest-running podcast specifically focused on the freestanding ambulatory surgery industry. We would like to thank our sponsors, Surgical Information Systems, providing cutting-edge information solutions for surgery providers, RFX Solutions, your all-in-one healthcare regulatory compliance software, MedServe, which is the only digital narcotic cabinet specifically designed and priced for surgery centers, helping standardize processes, compliance, eliminate paper logs, and prevent drug diversion, and Ambulatory Healthcare Strategies, the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, please visit our website at ascpodcast.com.
Welcome to episode 278 of the ASC Podcast with John Goehle, recorded on June 4th, 2026 from our studios in Spencerport, New York. I'm Sue Cronkite, your co-host and operations manager at Ambulatory Healthcare Strategies. As a reminder, the regulatory landscape for ASCs is constantly changing. The content in this episode reflects the most current information available at the time of recording. We encourage all ASCs to remain vigilant and keep up with any updates or any new guidelines released by relevant regulatory authorities. And joining me today is John Goehle, owner of Ambulatory Healthcare Strategies and one of the leading experts in the ambulatory surgery field. With over 3 decades of experience, John has authored more than 10 books on the ASC industry, and he is a highly regarded speaker on topics related to regulation, accreditation, and financial management.
So, Sue, it's been a while since we've done one of these episodes with news and everything. We have, I think, four special episodes, both at ASCA and at the New Jersey Association. So it's great to be back talking about ongoing things in the industry. And we were just at ASCA 2026. That was a couple weeks ago, wasn't it?
I guess. Yeah, that was you. You were off running around with most of our team at the conference, while I was one of the people who stayed back here to just keep everything running, so we didn't devolve into chaos. But yes, I heard a lot of good things about it. Yeah,
you did a great job. Thank you for keeping the business going while the rest of us were enjoying our time there. Yeah. We ran into a lot of people during the conference. Sometimes we only see these people once a year. There's a lot of good energy. You could tell everybody was ready for that in-person stuff again. I think that still an awful lot of stuff is still being done virtually, and we really crave that in-person side of it. But I'll tell you what a lot of people were saying, and I felt it too, that the hotel costs were noticeably higher than what we've seen in the last few years. It makes it tough for centers to afford to send more people. As a matter of fact, we cut back to 6 people this year from, I think we had 12 last year because of the cost of it.
Yeah, I was hearing a lot of that too. And obviously, when signing our group up, definitely notice it. So I think it's tough for people if they want to get a couple of their employees out there, or even just one person, and then they stay for a few nights, depending on where you're coming from. And the flight, it definitely does add up quick.
Yeah, I mean, I think the first couple nights we had dinner, and none of the bills were less than, $200. I mean,
it was in
for
Washington,
2 people.
It was in D.C. Right.
So, as I said, we did bring 6 people from Ambulatory Healthcare Strategies this year, and we were pretty much at the booth. We had a booth again this year the whole time during the exhibit hours. We had really good conversations, way better than I think we expected. And honestly, we got to see a lot of our listeners there too. And thank you very much for those of you that stopped by and said hi.
That's great. I know you love that when it happens, when you really get to be in person with some people that, you've been talking to on the podcast and like to hear, what people like, what they would like to hear more of.
Yeah, and I got to admit, I did like hearing people say wonderful things about the podcast, and everybody seems to know about our dogs.
No.
Yeah, and of course...
We never talk about them.
And for those that did not attend this year, we were giving away some of our stuffed Rosies, we call them. They look a lot like Rosie. They're a white golden retriever, and it was fun. I think I took 100 of them, and I still took some home. So, that's what happens when you don't stop by the booth, by the way. You miss out on the Rosies.
Well, and we had pens that had, screwdrivers built into them. So that was a cool thing. But actually, our Rosie stuffed animal looks a little bit gold, not a dark gold, but we're going to have to get, what do we do about Daisy? Do we need to get another one and make it a little bit lighter or smaller? Or she's getting to be the same. We'll just randomly call them Rosie or Daisy. And give credit to whichever one.
So it was a good conference. I ended up doing 2 sessions while I was there, speaking at 2 sessions. One was on materials management, which was I was kind of put in at the last minute. And it's not one of those areas, Sue, that I am the most familiar with, that I had a lot of good notes. I was filling in for another person and really enjoyed it. We had a lot of good feedback from it. And then did a workshop on strategic planning. Now, I don't do a lot of workshops. Most of mine are just like presentations.
I knew you were excited about it. How did it go?
It went very well. I had a lot of good interaction. It was kind of embarrassing a couple of times because I asked the audience, questions like, what do you do for your strategic plan? And one of our own clients came back and said, what do we do for our strategic plan? I didn't have an answer for her because I'm not that familiar with that particular organization. But
so that's the one you did with Alfonso, right?
Yeah, actually, Alfonso Del Granado and I were a team for the conference. We did both of those sessions together. And I think folks enjoyed the back and forth and the humor that we threw into it. At least that's what a few people told us afterwards. So we got some excellent reviews on it. He and I have talked before. This isn't the first time that we've talked together in a conference, and I think you'll be hearing more of us. I think they thought that we were a comedy team there at some point.
That definitely sounds like you. I don't know him, but I'm sure it made it feel less like a lecture and more like 2 guys just talking through stuff and keeping it entertaining. We hear that a lot with your sessions.
Absolutely. It was a lot of fun. But I get home and the business is still standing. Thank you, Sue. And Rosie's giving me that look like, where have you been? And Daisy's zooming around the living room like she's been storing up all that energy the whole time I was away.
No. She definitely used some up well. She didn't lay quietly the whole time. But I will say they were definitely ready for you to be back.
I think you were ready for me to be back, too.
Oh, and here's some exciting news. We just became members of the ASC Quality Collaboration. We call it ASC QC. And, they've been doing really good work on the quality and benchmarking side for a long time. And it felt like the right move to just step in and support that alongside a lot of the management companies and state associations. In our second segment, we're actually sitting down with Becky Ziegler-Otis, who's the Assistant Executive Director there. She's going to talk about what they do, what their and their focus on quality and ASCs, and an exciting opportunity to participate in their quality assessment project, which is wrapping up really soon. So we're going to get this out as quickly as we can. So if that's something you've been thinking about, you'll definitely want to stick around for that conversation.
Yeah, and it was during that interview that we learned that we could become members. We are actually we're not aware that AHS could become members. So that's all done, and we're starting work on that already. And I think they have a conference coming up, which we'll talk about in another episode.
Mm-hmm. So we are really glad to be a part of it. We've been familiar with them for a long time and use some of their information. So what else is coming up that people should have on their radar?
Well, if somebody does want to get out and do the in-person thing this summer, ASC News is doing their Investment and Operations Conference July 8th and 9th in Denver. That's one that's got a pretty focused lineup, and I'm going to be involved in it. It looks like I'm going to be on a panel there. They're talking about winning the talent war, the next wave of consolidation, and what it actually means for independents. navigating the payer landscape, and a session on AI that's supposed to cut through the noise and talk about where folks are already falling behind. Sounds like it's going to be heavy on some real conversations. And, following up on that AI, Sue, you and I just recorded an episode yesterday with Matt Galati, who did a great episode back in February, I think it was. And we're going to continue with that AI series for the rest of the year.
Yeah, and I do want to mention we do borrow a lot of news from the ASC News.
Right.
They have a lot of good information in there that they put out. So
which is why we mentioned
big fans of them.
Yeah, which is why we mentioned this upcoming conference, because we're really grateful for their assistance here.
Yep. And it should be really nice in Denver in July, hopefully, or at least it should be good. You never can tell almost anywhere these days what the weather's going to be like. And for anybody who would rather stay, closer to home and not deal with all the travel, what do we have coming up on the virtual side?
Well, we have finished the boot camps for the year. You might remember that we just finished the ASC Administrators Boot Camp last week. But we are working on a quality assurance conference for the third quarter and, of course, our annual multi-state conference, which we've had to move to December this year because of some other conflicts. We don't have firm dates yet for either of those. I know I keep announcing this and not having a date, but those still are firming up. But we do have a lot of on-demand content available right now in addition to the live virtual conferences. And we're actually building a new studio, which I think I've mentioned before, that's going to make its debut with the Quality Conference. All the details and everything that's currently available are over at ASC-Central.com. So, Sue, why don't we talk about some news?
Okay, so Ambulatory Surgery Center news, as we were mentioning. On May 11th, they had an article about Anthem insurer expanding their out-of-network policy and what's at stake for ASCs. So what the policy actually does, and I'll just give you some bullet points, 10% administrative penalty on facility claims when any involved provider, like anesthesiologist, radiologist, is out of network, that you will risk removal from Anthem's network if a facility routinely uses out-of-network clinicians. And this applies to Anthem commercial plans in 11 states now. California rollout is planned for June 1st, 2026. And Anthem says the policy is needed because some out-of-network clinicians are using the independent dispute resolution process as a backdoor payment channel for higher payment.
So that IDR program is coming under a lot of scrutiny now because it does seem to really cause some pretty significant increases or costs for the insurance companies. It seems to be pretty beneficial for surgery centers, but we knew that eventually something was going to have to give on this. And for those who are not familiar with the independent dispute resolution process, it allows or calls for an independent facilitator to look at the two sides, basically the charges, what the insurance company is willing to pay and what the physician or what the provider is asking for, and then choosing one number or the other.
Okay, so sometimes the insurance companies feel like they're forced into a different payment than what they had hoped to.
And that's correct. And really, I think there are many ASCs that actually say this is a rising crisis. Like we don't have enough crises right now in the ASC industry. But ASCs already face severe anesthesia workforce shortages, and many pay stipends now to anesthesia groups to offset lower reimbursement. And if Anthem penalizes out-of-network anesthesia use, ASCs may need to subsidize even more, worsening this financial strain. And we're already hearing that many ASCs actually have lost their bottom line because of the amount of the stipend that they have to pay to the anesthesia groups. And by the way, I should mention, Sue, that we have been trying to see if we can put together an anesthesia conference, a full-day conference involving, the various players there. We haven't been able to pull that together yet, but that is definitely one of our goals.
I feel like that has been the fastest-moving crisis.
Yeah.
I mean, I don't remember when it started, but I do remember that it was sort of like, oh, there's some issues here, and then boom, it's just gotten so out of control. It's a huge, huge problem.
Yeah, and I think to that point, I think it started in 2025, beginning of 2025, when we really started talking about it heavily. And as we've talked about on the podcast a couple times, this is not a problem that is going to go away anytime soon. Some of the people have indicated, some of the experts indicate that it could be 10 years before this problem is resolved.
Yeah, and as usual, ASCA is doing what they can to advocate. So Bill Prentice of ASCA argued that ASCs cannot control when contracted anesthesia, pathology, or radiology groups suddenly fall out of network. And the last thing you need to do is look for a new, anesthesia group.
Correct. If you even find one.
If because it falls out of network.
So, Sue, I noticed that the California Hospital Association has started a lawsuit asking the state superior court to block the policy that we just discussed, arguing that it violates California law prohibiting hospitals from conditioning privileges on whether a physician contracts with a specific insurer, and also that it violates false advertising laws because the PPO plans promise out-of-network benefits while penalizing providers who use them. Now, This is kind of specific to hospitals, but you can see how there's definitely going to be an impact on ASCs also. And legal experts say the lawsuit may gain traction because the penalties are unusually explicit and, of course, quite severe and really could impact the bottom line of many of our organizations, really threatening their very existence.
Yeah. And then, of course, physicians groups have put out a position. The organizations, including the ASA, the ACR, and ACEP, call the policy deeply flawed and operationally unworkable. And they say it's a threat to patient access because hospitals, and again, this is, I'm sure ASCs too, cannot guarantee every clinician stays in network. ASA President Patrick Guillaume says insurers should focus on building adequate networks, not punishing facilities.
I guess we should also mention that Anthem is also tightening reimbursement for moderate sedation, saying that it is often already included in the primary procedure or facility fee. And the ASC, the American Society of Anesthesiologists, I probably should have mentioned that earlier, is still reviewing this. So what does all of this mean going forward? ASCs and hospitals face rising financial pressure if these out-of-network penalties spread. And then, of course, the legal outcomes in California could set a national precedent. In many ways, I hope it does. Insurers and providers remain locked in a structural conflict created by the No Surprises Act and the dynamics of the independent dispute resolution process. And then, of course, patients remain protected, but the system around them is still very unstable.
And then Ambulatory Surgery Center News on May 27th had an article by Leslie Small about cardiac ablations moving to ASCs. This interview with David Kenigsberg, MD, who is the founder of Florida Heart and Vascular and the Fort Lauderdale Heart and Rhythm Surgical Center, offers several important strategic insights for ASC leaders, physicians, operators, and investors, particularly as more complex procedures move into the outpatient setting. The biggest news is that CMS approved cardiac ablations for the ASC setting beginning in 2026, which opened the door for one of cardiology's most complex and lucrative procedures to move out of the hospitals. So this will expand the types of high acuity procedures in ASCs, creates a new growth avenue for cardiology-focused centers, continues the broader trend of hospitals losing exclusive control over complex procedures, and it may attract more physician investment in ASC development.
This is really a major new growth opportunity for surgery centers. But I'm seeing in certain states, in particular New York, for example, that there's quite a bit of pushback from the hospitals, and they're really and I understand the argument. You know, these are very complex procedures, and the ASC environment, while we're not familiar with the procedures, we do complex procedures, and we do procedures that have traditionally been done in the hospital environment. But I think legislators are looking for a little bit more information before they wholeheartedly jump into it. Mm-hmm. So, Sue, I think the concern I have is that staffing still remains the biggest operational challenge here because, well, first of all, we don't necessarily have enough staff to even manage the procedures we're doing now. Yes. But the people that are involved in these procedures are even more highly trained, and they're all working at the hospital. And trying to convince them to come to an ASC setting might be difficult since they're often paid probably pretty well over in that.
Yeah.
So
Dr. Kenigsberg definitely pointed out that workforce planning should occur well before you're expanding into a new service line, especially a complex one like this. You have to be sure you've got the right staff in place.
And again, the anesthesia shortage we just talked about is a significant risk here in particular. And it's often one of the most persistent challenges in staffing these procedures. Finding anesthesiologists for cardiac procedures is difficult in hospitals and even harder, of course, in an ASC. Mm-hmm. So again, expansion may be not very easy to do without anesthesia support, and particularly getting anesthesia experts that are familiar with these procedures. And of course, anesthesia costs can significantly affect the ASC's profitability, even with the higher reimbursement that often comes with these cardiology procedures. Centers should secure long-term anesthesia partnerships before launching into any of these complex programs.
Should we talk about these things, or is that too specific? Just go to how
capital.
A good thing, the patient satisfaction.
Let me deal with 5. Okay. So, and another thing, Sue, that I think we should mention is that these procedures are not cheap to do. The capital costs involved are quite enormous. Sometimes you might be able to fit it or retrofit your facility, but the operating rooms tend to be larger. There's control rooms associated with them, and of course the equipment is very expensive. So organizations have to have a lot of capital resources and room to be able to expand into these procedures. And you might not find that the rooms that are being used for cardiology procedures are easily also used for other types of procedures in your center. Yeah. But I think, patient satisfaction is going to be a major competitive advantage. Dr. Kenigsberg pointed out the advantages for patients in an ASC, such as faster registration, shorter wait times for, being scheduled, same-day discharge, which doesn't always happen in the hospital. And what we always know is that patient satisfaction scores in ASCs already are in the 90% plus range. But Sue, right, it's important to remember that not every cardiac patient belongs in an ASC. Yes. So those hospitals are still going to be doing really a substantial number of these procedures. And I think that's the key takeaway here is that, you're going to have to do a lot of planning before you determine who's an appropriate candidate for your surgery, as well as coordinating with the physician to make sure that he or she is well aware of what the ideal population is.
And we've talked about this before, how as these higher acuity things, whether it's ortho, cardiology, spine, as those move out of the hospital, you really have to beef up your patient selection protocols.
Yeah, that's absolutely right. And I think even more so here because you can have a lot more. These patients, by definition, are already going to have major problems. So they're already going to be in ASA 3 most likely, and therefore, having a lot more issues. So I wanted to bring up something that came up during one of our drop-in sessions, and that's physician education. One of our attendees asked, what type of information does a physician have to have as part of their annual mandatory education program? And this individual actually said, well, I sign them up for like HealthStream or MedTrainer, one of these online portals. But as I pointed out to her, MedTrainer and HealthStream provide general training. And most of the time, that general training really doesn't apply to physicians. What we're looking for in an ASC for training or for the annual mandatory training for the physicians is going to be something that is going to be all those things that are specific to that organization, such as your infection control program for the ASC, the safety program, the risk management program, the emergency plan, the fire plan, how to do incident reporting, what your transfer policy is, reviewing the peer review program, and of course the quality improvement program. All of those things are specific to your ASC, and it's not something you're going to be able to get from HealthStream or MedTrainer unless you upload all that information into that. And most of the time, I, as a surveyor, when I'm looking at these programs, don't see that the ASC has done anything specific to their organization. Again, both HealthStream and MedTrainer have the capability of uploading individual programs, but unless you take the time to do that, it's not going to be relevant information for the physicians. I think the ideal thing, the way that we've often done it, is we've created a binder with a lot of the information, the policies and procedures, the programs, and an overview of the education program there, as well as a sign-off sheet for it. And that tends to be able to satisfy the surveyors when they look to see that there is ongoing education and training for the physicians. And I guess I need to point out also, remember all of your volunteers, if you have any volunteers, students, anybody that comes into the ASC on a regular basis is going to have to go through this training program also. And while we're on that subject, I should point out that agency nurses also need to have that training. We've run into that recently, Sue. Sometimes I don't even know, like when I'm on a survey, unless I specifically ask the question, are you using agency nurses, that they have those types of employees and they need to be treated. All those agency nurses need to be treated the same way an employee does. Yeah. Well, that was a lot of news for episode. Let's take a short break, and when we come back, we'll have our interview with Becky regarding the ASC Quality Collaboration. Every ASC professional knows that running a surgery center takes knowledge, skill, and a strong support network. That's why we created ASC-Central.com, a place where ASC leaders and staff can learn, connect, and grow together. ASC-Central is a comprehensive hub for education and professional development in the ambulatory surgery industry. Our leadership bootcamps, on-demand conferences, and membership programs are designed to meet the needs of administrators, nursing leaders, medical directors, business office managers, and anyone committed to excellence in outpatient surgery. Our leadership bootcamps are guided, mentored programs that help develop the next generation of ASC leaders. Whether you're new to your role or looking to refine your skills, these bootcamps provide the structure and insight you need. And many of them offer AEU credits for CASC certified administrators and IPCH credits for CAIP certified professionals, supporting your ongoing professional certification. ASC Central's on-demand educational library gives you access to in-depth programs on compliance, quality improvement, infection control, credentialing, finance, and more. These full-length virtual conferences are designed to be both informative and engaging, not just check-the-box webinars. Many also include CASC and CAIP continuing education credits. For those who want ongoing learning and connection, ASC Central offers flexible membership programs. The Patron membership gives you access to Zoom discussions, key conferences, and a robust resource library. The Premium Access membership adds full access to all boot camps, private consultations, staff training, exclusive content, and ongoing support from top experts in the ASC field. If you want to be part of a community dedicated to raising the bar in ambulatory surgery, visit asc-central.com or email us at info@ascpodcast.com. ASC Central, bringing ASC professionals together to learn, grow, and thrive. I'm here with Becky Ziegler-Otis from the ASC Quality Collaboration. Welcome, Becky.
Well, thank you for having me, John. I appreciate being here today.
So first of all, why don't you introduce yourself to the audience?
Okay. My name is Becky Ziegler-Otis, and I am currently the Assistant Executive Director of the ASC Quality Collaboration, which is sometimes referred to as the ASC QC. The Executive Director of the ASC QC is Nina Goins. Prior to my role that I have right now, I actually worked, as many of you who are listening to this today, as an independent administrator, working in an independent center. It was a physician-owned multi-specialty center. And so I can totally relate to many of you who might be listening to this and are saying, I am part of an independent center and I have so many hats to wear, and how do I get all the things done? And so that's why I feel I can help you today in talking through this podcast a little bit with some advice for your quality programs.
And just as a note, Becky and I go way back. We, of course, have been staunch supporters of independent ASCs for most of our careers. So, and we've been very active in ASCA together over the years. So it's great to have you for the first time on our podcast. So it's, as I mentioned to you before we started recording, we at Ambulatory Healthcare Strategies use your product a lot and encourage our surgery centers to use it as part of their benchmarking. As a matter of fact, I was on a survey yesterday. One of our centers was being surveyed, and in their quality improvement minutes was a copy of your quarterly survey. And I don't think the surveyor had ever seen it before. She said, "This is fantastic." I said, "Well, that's the ASC Quality Collaboration." So why don't you tell us what the ASC Quality Collaboration is and how it can help our surgery centers out there?
Sure. But first of all, John, I have to say that story warms my heart.
Yeah.
It warms my heart because that's actually what I would do as well with the ASC Quality Collaboration data. So thank you for sharing.
Sure.
So the ASC Quality Collaboration, which is sometimes referred to as the ASC QC, not to be mistaken for the ASC Quality Reporting Program.
Right.
Many times people confuse us with that government agency, where you have to report your data, but we're the ASC QC, Quality Collaboration. And what we do is we really focus on ensuring that surgery center industry has good quality data that's being measured and reported in a meaningful way. So we as a collaboration, we bring together leaders from across the ASC industry. They are associations and organizations. So our membership, when I say associations and organizations, it's organizations such as ASCA, AORN, ECRI. We also have membership ASC state associations, about 7 of them right now. Our members include IT software companies. So we have HST and SurgeLogs, for example. And we also have the accreditation organizations that are members of our association. And we actually are represented now by all 5 of them as part of our organization, which is great. And the reality is we're all unified by one purpose, which is really to advance the patient safety and quality of care in ASCs. The organization itself was founded back in around 2006 with the purpose to really support standardized quality measures. And their vision was really to serve as a resource for ASC safety and quality. And just a little fun fact, most people don't know this, that the ASC QC was the originator of developing the first 6 ASC quality reporting measures. And so in that, they also remain the steward. The organization remains a steward of that, making sure that the measure remains reliable. And we also do some ongoing evaluation and analysis of it. So that's a little bit about us. A lot of people, John, confuse us with ASCA. I think it's because our acronyms are so very close. We work really, really close with ASCA. As a matter of fact, Bill Prentice, we're proud to say that he's on our board. And that's wonderful that we work very well together. But we are separate entities with our sole purpose being focused on patient safety and quality in the ASC community.
So how can our listeners participate? How can they use the data? How can they, become a member even if they, if that were something they were interested in?
So I hear frequently from independent ASCs, and we would love to have them as members. But at this point, it's just not possible. We're not there yet. You have to be part of a management company or through a state association. So as far as becoming a member, that's not possible. However, what I would like to say is that what we have to offer you is very robust, and I would encourage you to use that. So our website, which is ascquality.org, encourage you to go out on that website. That is where you will find our benchmarking data. And we have benchmarking data for 9 different measures. And we collect that data quarterly from our membership organizations. And the beauty of it is, for those that are listening and you want to use that for external benchmarking, is that when you look at each of the measures, first of all, we provide definitions. So you want to make sure that if you're going to compare with us, you're comparing apples to apples. When the results are gathered, we gather it from over 2,000 ASCs. And it represents about 2.5 million encounters. And that will be represented on each of the individual measures that you look at publicly on our website. That data comes out quarterly, which means you don't have to wait 2 years for the CMS data to come out. But in fact, for example, the end of the first quarter, your data for that will be posted publicly on the website for you to see by the end of the second quarter, typically by the last day of the second quarter, because it takes some time for validation, but it will be there. And we encourage you to take that data. That's what I would do as an ASC administrator. I would take that data and I would fold that right into my quality tracking so that I could use that for external benchmarking and helping my organization move forward.
So parenthetically, we at Ambulatory Healthcare Strategies, all of our centers actually use your data. So they go into the ASC Quality, ASCquality.org website, and every quarter they download the report, which is very nice looking, and then they attach that to the quality improvement minutes, and then they compare their data to the data that's in there. And here's the great thing: you don't have to actually submit data to be able to use that data, correct?
That is correct. Yes. You have your own data, so you can show your own data for your governing body and just use that external benchmarking aggregate data as comparative data. That is actually what it's built for. And, aside from that is once you start looking at that data, let's say you have identified some opportunities for improvement. So, John, I want to make sure that everyone is aware we also have a number of toolkits on our website.
Correct.
Which are great resources. I believe there's 9 of them. And the most recent one that we posted out there is on wrongs. So I would encourage anyone to check out our resource section, because those toolkits provide policies, procedures, some training, all sorts of different tracking audits that can be used. They're very valuable, and we update them on a regular basis.
Yeah, and we've actually referred to those toolkits a couple times in the podcast and provided links to our audience. And I think we're going to do a better job of that, because as they come out, they really tie into some of the topics we talk about on the podcast alone. So I think that's a great point. I wanted to also point out that, we get a lot of surveys among our centers at AHS. And we have never run into any accrediting organization, or for that matter, any state surveyor who has had a problem with that being benchmark, true benchmarking data. Now, not to say that ASCA's benchmarking and the state associations that do the benchmarking can't provide valuable information, but not everybody can afford that, especially a lot of our independents out there. So I also want to point out, it is important that you don't just attach the report to your minutes. You've got to refer to it. You got to compare your data to it. And to your point, turn it into a QI study, turn it into an activity, identify why you might be different from those numbers.
Yeah. Well, and I love you talking about the fact that it's free. I mean, that is so important, especially to those of you that are independents. I mean, we know how you have to really maintain the costs and how tough that is to be able to purchase, different things for external benchmarking. This is free and available to everyone.
So can you talk a little bit about the statistical validity of this? Because there's a lot of data points that you gather on a quarterly basis.
Right. So the data that is actually submitted from the management companies that comes into the data reporting program, we actually do a number of validity checks that are done behind the scenes once the data is submitted. And after that data is submitted and we take a look at it and run these various checks on it, we actually then send it back out, and it has to be attested to if we've got any questions, so we can make sure that the data stays solid, reliable, that individuals can really rely upon that information. So yes, there is validation testing that happens with that data.
And you have a lot of, the number of data elements that you get, the number of responses you get on a quarterly basis is huge, actually, compared to even ASCA and the state associations, correct?
It is. I mean, when you look at the quarterly report and you see that, it can represent as high as, and even a little higher, sometimes 2.5 encounters, whichever way you want to look at that. That is reliable data. That is definitely reliable data. It tells a story when it's that robust.
Right. And you're not going to find huge variations like you sometimes see with some of the state data in particular, or sometimes the ASCA data as, different, because it's not always the same people participating every month in both of those elements. So this is, I as a former statistics teacher, that's one of those things that I really take seriously, is making sure that when we're analyzing data, when we're comparing that data, we want to make sure that we have accurate data to go off of.
Yeah, boy, and I didn't realize I was talking to such a statistician, so I haven't covered that well. But, you bring up another point that I also didn't mention, is that it really is the same entities reporting, or typically it's, the same entities that are reporting quarter by quarter in that data. We're always looking to add more in, as different management companies have centers that want to add their data in, that is open to it as well. And once again, making sure the data is submitted properly and tested.
Yeah. And again, if you are listening and you're part of a management company or a state association, we encourage you to participate in the reporting also. I know not everybody does, but the more reporting, the better. And of course, it makes it easier for you to be able to compare your data against the data that comes back, from the quarterly reports. So you got something coming up, a deadline coming up, right? Why don't you talk a little bit about the ASC Safety and Quality Assessment?
Well, we do. And this is exciting. And so as we were talking about benchmarking, we have another opportunity for all of you that are listening today as independent centers, and we hope you consider participating. So we have something that we started about a year ago. It's called our annual ASC Safety and Quality Assessment. And this is a submission that is open between the time period of May 1st and June 15th. It takes about 20 minutes to go through. And what it is it's a survey where you go to our website, you can click on a link and get started. You'll start off putting in some demographic information, some case volume information, and then there's going to be a series of questions that surround a number of topics, such as patient experience, patient safety, culture of safety, infection control and prevention. And what the questions are really asking you in those categories that all relate to quality and patient safety is they're really asking you about some of the, and I'll call them best practices, or the things that are good to have in place as it relates to those categories. So for instance, under the quality and performance improvement, it might ask you, for example, do you have a quality improvement plan? Have you had a process that you've improved over the past year? It's going to ask you a series of questions, and the majority of them are yes, no questions. You go through this. And then once you're done, I think as you're going through it, you're able to think, oh my, I don't have this. I don't have this in place at my center. Maybe this is something I should consider. So I think it helps you self-assess yourself. Takes about 20 minutes. When you're done, it gets submitted. And then about 6 weeks after that, you will get a report back that is center specific, showing how you did on this survey, how you answered the questions. It's like a dashboard. They're actually very nice looking. Mm-hmm. And in addition to that, you will have a comparative of everybody else who participated in the survey. And so that's why I would encourage as many of you as possible to consider participating, because the bigger that aggregate is, the more robust that data is going to be. The last I checked, we had about 400 submissions, which we're really pleased about. Last year, that's about how many we had. So we'd love to have many more. When you get this aggregate report, it's going to come to you. It really does look nice. It's something you can take directly to your board, show what you're doing as far as quality and safety practices in your center compared to the aggregate. Helps you identify where your opportunities might be to kind of push yourself a little bit forward. It's something that it's confidential. We're not going to share it. This is strictly for you. You may want to use some of that information to share with your payers, to show that you have great programs in place. Right. Compare yourself to the aggregate. Share it with your patients. It has some great value. And once again, it's complementary.
And I think that's something important here is that you don't have to be a member of any of the organizations. You can participate. It doesn't cost you any money at all.
Correct. Yeah. As I talked earlier about our membership organizations and how that was limited, this is not limited. We are encouraging everyone, because it really is part of our mission to push that needle forward for quality and safety and be able to demonstrate that value of the ASC industry overall. And that's what this is attempting to do for individuals on an individual level as well as on an aggregate level.
So, and it's important to note, this is separate and distinct from the reports that come out on a quarterly basis from your partner organizations here. So this is like another type of external benchmarking that you can be doing. And like you said, I would encourage you running it through your quality improvement, take it right to the board. It'll help, surveyors. I, as a surveyor, when I see a report like that in the minutes of the quality improvement committee, and even if it identifies some opportunities for improvement, I would be, very grateful to see that in your report, because it shows that you really are taking quality improvement seriously. You're identifying opportunities to further improve what hopefully is already a very high quality organization.
And interesting, John, when you mentioned about what's publicly available, we won't be putting the aggregate results on our website. So that's why this truly is an opportunity to participate individually, because that information won't be available on our website publicly, aggregate wise, so that you could take and compare after the fact. It is really just something that we provide as an individual report. So I think it's really powerful information that can really help you look at your quality and safety practices, kind of see where you might be falling short, and an opportunity for you to improve.
Right. And I do want to emphasize again, even if it identifies some things that you're not necessarily doing right now, we as surveyors, we want to see that you're pushing the limits there. You're looking for opportunities to improve. We're not going to penalize you because you're missing some of the elements there. We're going to cite you, of course, if you don't have a robust program, but always looking for opportunities to improve that program is essential to any quality improvement program. So I think this is great. We're going to provide a link to the actual assessment tool, as well as the a lot of information on your website with the show notes for today.
Well, that's great. We appreciate that, John. And I guess I can't emphasize it enough. It really does not take long to do. And I think the benefit that you're going to get out of it is immense. As far as what you have to gather, I've heard some people say, well, is it hard to get started? Do I have to gather a lot of information? So really, I think the biggest thing would just be start off knowing what your CCN number is if you have a Medicare number. Yeah. Make sure you know your NPI number. And I think having some information on volume of your number of visits for the past year, that might be maybe the only statistical thing that you'd have to consider. Otherwise, it's a series of questions, and it truly does take about 20 minutes. There is a validation process as well, John. I'm sure you would like to know that. So once we get all the submissions, we actually do a validation. So a random number of centers will be selected to participate in the validation process. And that's how we make sure that the aggregate data is good, reliable, robust information.
And when you go in and click on the link to begin the process, it does give you a PDF of this information you want to gather before you actually start the survey. So it's very well laid out, and I think it would be pretty easy. The list of items is not super long, so I think everyone can participate. Any ambulatory surgery center, especially, we do want to see those independents participating also.
And I think if you're nervous about what's all required, as John said, you can click on that link. And actually, as you go through the survey itself, there is a set of instructions that you can refer back to that will clarify what it is that is being looked for in a particular question. So I think that is helpful as well.
Yeah, just print it off and have it with you as you're going through it, and you should be able to finish it pretty quickly. Well, this has been fantastic. And, Becky, you and I have known each other a long time, and I can't believe that this is the first time you've been on the podcast. So I think definitely we need to talk periodically, and we're going to want to try to get you involved, also the organization involved, with some of our other conferences coming up. So thank you so much for your time today.
Thank you, John. We'd love the opportunity.
In this segment, we provide an update on upcoming topics for the podcast, our upcoming virtual conferences, and upcoming speaking engagements for John and his staff, and other events in the ASC industry.
So the Gulf States ASC Conference, that's Alabama, Louisiana, and Mississippi, are getting together in a couple weeks, June 17th through the 19th at the Ritz-Carlton in New Orleans.
And the Arizona ASC Association's conference is June 24th through the 26th at the Sheraton Grand at Wild Horse Pass in Phoenix, Arizona. And John will be there.
That's right. I'm doing a speech there, at least one. And also I'm going to record a special episode. I'm just excited about going to a place called the Wild Horse Pass. We'll see how that goes.
Fun. Yeah.
And the ASC News Investments and Operations Conference, as we mentioned earlier, is on July 8th to the 9th in Denver, Colorado.
And the 2026 Colorado ASC Association's annual education conference and trade show is July 16th and 17th at the Denver Marriott West in Golden, Colorado.
Looks like I'm going to be spending some time in Denver, I guess, Sue. And I'm going to be speaking at that conference. And again, we'll be doing a special episode from there.
And the Florida Society of Ambulatory Surgical Centers annual conference and trade show is July 22nd through the 24th at the Hyatt Regency Grand Cypress in Orlando, Florida.
The Illinois ASC Association's annual meeting is going to be August 20th through the 21st at the Renaissance Schaumburg Convention Center Hotel in Schaumburg, Illinois. I hope I pronounced that properly. And I believe I'm going to be speaking at that conference also.
And the California Ambulatory Surgery Association's annual conference and exhibits is September 2nd through the 4th in Monterey, California. And
we are talking to CASA right now about our attendance at that program. I believe that we're going to be doing a special episode from there. And the Pennsylvania Ambulatory Surgery Association's annual meeting and educational conference is October 4th and 5th, 2026 at the Eden Resort in Lancaster, Pennsylvania. And it does look like we're going to be there, perhaps with a booth. And if we can fit it in, we'll also be doing a special episode from there.
In the Atlantic States ASC Conference, which includes North Carolina, South Carolina, and Virginia, is October 8th and 9th at the Embassy Suites Raleigh-Durham Research Triangle in Cary, North Carolina.
And the Oregon ASC Association's annual conference and trade show is October 15th and the 16th at the Holiday Inn Portland in Williamson, Oregon. And I'll be speaking at that conference again this year, as well as doing a special episode.
And the New England ASC Conference is October 23rd at the Hilton Boston Dedham Hotel in Dedham, Massachusetts.
And I'll be speaking at that conference also, and we are, I think, going to have a booth there. We haven't quite finished that, and if we can also fit it in, we'll do a special episode from there also.
And the Ohio Association of Ambulatory Surgery Centers Annual Education Conference is November 11th and 12th at the Ohioan Hotel and Event Center in Lewis Center, Ohio.
And Lori Rodricks is going to be speaking at that conference. Unfortunately, it conflicts with my Washington Association conference, which we'll talk about in a second. And we'll have a booth there also. And as I mentioned, the Washington Annual Education Conference and Trade Show is November 11th through the 13th at the Tulalip Resort and Spa in Tulalip, Washington.
And the New York State Association of Ambulatory Surgery Centers Annual Conference is November 17th and 18th, 2026. At the Desmond in Albany, New York.
And as usual, we'll have a special episode from that program also. And don't forget, on-demand versions of the ASC Director of Nursing, ASC Administrators, and ASC Business Office Managers bootcamps are available on our sister website at asc-central.com. And I should point out, even though we finished our bootcamps for the year, these on-demand versions of the boot camps are available all year round. And, you know, in keeping with our conversation earlier, the on-demand versions too are much more popular, of course, than the live ones, which is sad because we do like that interaction that we have with the audience, even if it's all virtual. But the on-demand versions are a complete recording of one of our live conferences. And we do want to remind everyone to become a patron member of the podcast. Don't miss out on this opportunity to engage in all of the benefits for joining our patron member program, which is available at asc-central.com. This is a comprehensive membership platform for all aspects of ASC regulatory and accreditation, compliance, operations, and financial management. And it is really designed with the understanding or the problems that the busy schedules of administrators, nurse managers, and business office managers encounter every single day. And by becoming a member, you gain access to our regular Zoom sessions, which are typically held weekly, where you can engage with other patrons and our podcast team. But that's really just the beginning. You also have access to our member benefits, which include various conferences, both pre-recorded and live virtual conferences, as well as access to a database of sample policies, procedures, forms, and our highly regarded fire and disaster drill kits. Your support of our patron program helps us maintain and grow the podcast, covering essential costs like research, travel, equipment, and production. And, of course, our brand new studio. So to learn more about and to become a member, visit asc-central.com.
Thank you for tuning in to this episode of the ASC Podcast with John Goehle. We hope you found the discussion insightful. If you did, please share it with your colleagues in the ASC industry and be sure to subscribe so you never miss an episode. We appreciate your feedback and suggestions for future topics. Reach out anytime at comments@ascpodcast.com.
And a special thank you goes out to our incredible team here. Our sound editor, Susan Cronkite, executive producer, John Goehle, and our committed research team, Sue Cronkite, Jenna Alvarez, Christina Norman, Judy D'Ambrosio, Mike D'Ambrosio, Zach Calritis, Jim Masters, Stuart Rosenberg, Amy Cronkite, Lori Rodricks, Kathy Foti, Donna Macchio, Kelly Frankenfield, and Tony Lyons. Your hard work makes this podcast possible.
Our theme music is by Media Sushi and Mike Noah. The ASC Podcast with John Goehle is hosted on Podbean and can be found on all major podcast platforms. Thanks for listening, and we'll see you in the next episode. This episode of the ASC Podcast with John Goehle is sponsored by Surgical Information Systems, RFX Solutions, MedServ, and Ambulatory Healthcare Strategies. Surgical Information Systems provides cutting-edge information solutions for surgery providers. RFX Solutions is your all-in-one healthcare regulatory compliance software. MedServ, which offers the only digital narcotics cabinet specifically designed and priced for surgery centers, helping develop standardized processes and compliance, eliminate paper logs, and prevent drug diversion. And Ambulatory Healthcare Strategies is the nation's leading regulatory and accreditation compliance resource for ambulatory surgery centers. For more information about our sponsors, visit our website at ascpodcast.com. This podcast is an educational and operational tool and is not intended to be a comprehensive resource for all rules, regulations and standards that an ambulatory surgery center must meet. The advice provided should not be considered as, nor does it constitute legal advice or opinion. When reviewing specific situations involving legal and regulatory issues, attorneys and other professionals should be consulted. This has been a production of Eden Group Development. All rights are reserved. If you're interested in advertising or sponsoring the ASC Podcast with John Goehle, please email us at info@ascpodcast.com. We would love to hear your questions and comments. Please email us at comments@ascpodcast.com.